HIPAA compliance, phone and PHI. Understand and follow the HIPAA privacy rule. Apply safeguards to protect PHI during phone calls. Never disclose PHI without patient authorization, unless required by law. Be mindful of your surroundings to prevent accidental PHI disclosure. Only use authorized devices for PHI communication. Report any suspected PHI breaches immediately. Verifying identity on the phone. Ask for the patient's name and date of birth. Verify the phone number on file. Ask for additional identifying information if needed. Use a callback verification process. Do not ask for sensitive information like social security numbers. Document the verification process. Handling PHI over the phone. Avoid using speakerphone. Use a private room or area. Lower your voice. Do not repeat PHI unnecessarily. End the call securely. Understanding PHI and ePHI. PHI is protected health information. ePHI is electronic protected health information. PHI includes any identifiable health information. ePHI is PHI transmitted or maintained electronically. Both PHI and ePHI are protected by HIPAA regulations. The HITECH Act explained. The HITECH Act was enacted in 2009 as part of the American Recovery and Reinvestment Act. Promotes the adoption and meaningful use of health information technology. Strengthens civil and criminal enforcement of HIPAA rules. Increased penalties for HIPAA violations. Introduced the concept of business associates and their responsibilities. Documenting calls securely. Create a system for documenting phone calls that contain PHI. Only include the minimum necessary PHI. Store documentation in a secure, designated location. Only allow authorized personnel to access documentation. Dispose of documentation securely. Insurance call, follow-up handling. Check patient information is correct and up to date. Verify insurance coverage and eligibility. Clearly document call details and outcomes. Follow up on claim status and appeals, if necessary. Adhere to all HIPAA regulations during calls. Reporting and avoiding HIPAA breaches. Be vigilant and look out for potential HIPAA violations. Report any suspected HIPAA violations immediately to your supervisor or compliance officer. Take immediate action to mitigate any harm caused by a breach. Document all incidents and actions taken. Regularly review and update policies and procedures to avoid future violations. Cybersecurity essentials. Use strong passwords and two-factor authentication. Encrypt PHI and ePHI data at rest and in transit. Install antivirus and anti-malware protection. Conduct regular risk assessments and employee training. Implement access controls and audit trails. Have a plan for incident response. HIPAA compliance for remote work. Use a secure and encrypted connection for work. Ensure PHI is not accessible to unauthorized individuals. Use a VPN when on public networks. Be aware of surroundings to avoid accidental PHI disclosure. Lock your computer screen when away. Only use company-issued devices for work. HIPAA compliance for independent contractors. Only access PHI on secure, encrypted devices. Use a VPN on public networks. Be aware of your surroundings to avoid accidental PHI disclosure. Lock your device when away. Ensure PHI is not accessible by unauthorized people. Follow the same HIPAA rules as an employee. ePHI access for international independent contractors. International independent contractors with access to ePHI must comply with HIPAA regulations. Ensure all ePHI is accessed on secure, encrypted devices. Use a VPN when on public networks. Lock your device when away. Ensure ePHI is not accessible by unauthorized people. ePHI minimum use rule. The minimum necessary rule applies to ePHI. Only the minimum necessary ePHI should be shared to satisfy a purpose. Applies to healthcare providers, health plans, and clearinghouses. Business associates must also follow this rule. Workforce members should only access ePHI they need to do their job. Best practices for ePHI via email. Only send ePHI via email if necessary and authorized. Encrypt all ePHI before sending. Double-check email addresses before sending. Include a disclaimer in the email. Promptly notify recipients of errors in transmission. Follow up with recipients to confirm receipt. Provider data security and HIPAA. When credentialing providers, ensure that all PHI data is secured in compliance with HIPAA. Only share the minimum necessary information with credentialing entities. Obtain a signed BAA with any credentialing entity that will handle PHI. Ensure all PHI data is encrypted, both at rest and in transit. Store PHI data in a secure location with limited access. Conduct regular audits and risk assessments to ensure compliance. Best practices: minimum necessary and remote access. Only access and share the minimum amount of PHI needed to do your job. Apply the minimum necessary rule to all forms of PHI: paper, oral, electronic. Access PHI using secure, company-issued devices on a secure network connection. Use a VPN when accessing PHI via a public network. Ensure PHI is not accessible to unauthorized persons. HIPAA breaches: low versus high risk. Low risk: unintentional, affecting few individuals and unlikely to reoccur. High risk: intentional, affecting many individuals and likely to reoccur. Risk level determines response and required notifications. HIPAA doesn't have specific definitions for these categories. Organizations must conduct a risk assessment to categorize properly. Importance of breach reporting. Examples of PHI breaches: sharing data with unauthorized parties, improper disposal of records, and losing a device with PHI. The Department of Health and Human Services, HHS, must be notified within 60 days of a breach affecting 500 or more people. Breaches impacting fewer than 500 people are recorded in an annual report to the HHS. Immediately report any suspected or known PHI breach to your supervisor or compliance officer. Know your HIPAA contacts. Always know who your HIPAA security officer is. They are your point of contact for questions or concerns about HIPAA compliance. Report any potential security breaches or incidents to your security officer immediately. Familiarize yourself with your organization's HIPAA policies and procedures. Ask for clarification on any points you don't understand. HIPAA key takeaways: understand and follow the HIPAA privacy rule. Protect PHI during phone calls and other communication. Use and disclose PHI only as permitted by HIPAA. Safeguard ePHI using strong passwords, encryption, and other security measures. Comply with the HITECH Act and other related regulations. Report HIPAA violations immediately to your supervisor or compliance officer.